Today, we're going to talk about the PSA test, what your numbers really mean. Well, this is a question that I get asked all the time in my clinic. Men will come in, they'll have a PSA test, they'll get the results back, and they don't really know what they mean. And so they come see me, and I think that's great. I want men to be informed about their health. And so that's why in this video I'm going to explain exactly what these numbers mean. So first of all, when you go get your PSA test, it's important to realize there are different types of PSA tests. There is the one that you can do at home, which is a urine test where you just collect your urine in a cup and then send it off to the lab. And then there's the blood test. Well, the blood test is much more accurate. It's going to give you a number. The urine test is less accurate and usually is only used if you're not able to get a blood test for some reason. So if you've had a PSA test and it's a blood test, that's what we're going to be talking about today. So when you get the results back from your PSA test, there are actually 4 things that you need to look at. And unfortunately, most doctors don't tell you this when they go over your results. So you need to look at your PSA number, your free PSA number, your PSA density, and your prostate volume. And all of these together give a full picture of what your PSA results are. Well, let's start with the PSA. This is the number that everyone always focuses on, and it stands for prostate-specific antigen. And essentially, this is a number that tells us how much protein is being made by your prostate. So if your prostate is making a lot of this protein, your PSA will be higher. If your prostate is making less protein, then your PSA will be lower. But what does that really mean? Well, that depends on your age. As you age, your PSA will naturally increase because as your prostate gets bigger, it makes more of this PSA protein. And so when you look at a normal range for PSA, they're going to split it up into different age groups. So, for example, if you're younger than 50 years old, a normal PSA is anything below 4. 5 nanograms per milliliter. Between 50 and 60, it's anything below 6. 6, and over 60, it's anything below 8 nanograms per milliliter. Now, these are just average ranges, so sometimes you'll see a lab value sheet and it might say 0 to 2 or 0 to 3. But again, those are just average ranges. They're not absolute ranges. And so even if you're above these numbers, it doesn't automatically mean that you have cancer. So next, we need to look at your free PSA. Now, the total PSA, like we talked about before, is the total amount of this protein in your blood. But the free PSA is the amount of this protein that is not attached to anything else in your blood. So this is a very important number, because if you have a high free PSA, it's less likely to be cancer, because that means your prostate is just making a lot of PSA and it's kind of like diluting the total PSA, so it's less concerning for cancer. So this gives us an idea of how much PSA is actually being made by the gland itself. This is a good screening tool, but unfortunately, not every lab is going to calculate this for you. And then lastly, we look at your prostate volume. How big is your prostate? Because again, if you have an enlarged prostate, it's going to make more PSA, so it's important to know your prostate volume. And you can get this done through a digital rectal exam, or you can get it calculated from an MRI or even a biopsy. So the bottom line is that if you have any concerns about your PSA, definitely talk to your doctor about it. Don't just look at the number and freak out about it. Have a discussion with your doctor. Also, I want you to share this video with your friends so they can learn about what the PSA numbers mean. And lastly, if you haven't already, please subscribe down below. Thank you so much for watching, and we'll see you next time.